one last thing. What is endoscopic?
It's just a medical term for keyhole. So as opposed to cutting and making a big wound to get to the hip,
Okay.
making two small holes, like really literally a keyhole.
Interesting.
Yeah.
How many holes?
Interesting.
2 or 3. What kind of holes are you interested in?
Welcome back to Dr. Sewan Hall. What a beautiful day it is. And honestly, today I want to ask Dr. Tony one important question. Dr. Tony,
Yes,
do you play sports?
of course, I do.
What sports do you play?
I play badminton.
Badminton, you must be a bad boy.
What about you?
I play basketball.
Basketball.
I love basketball, I love running. You know, sports is a very important part of life. Don't you
Correct.
think so?
I agree.
It's-
It's really
it's-
important.
Yeah, it's mentally well and physically good for your body too, right? And honestly, right, I think, for example, when you play sports, you can get injured quite easily as well.
Yeah.
Especially, for example, now if you're like Dr. Tony, you know, you're as tall as Goliath, for sure, you can kind of langgar by lorry like that.
By you.
Right? By me,
By,
yes!
by
give me
David
a
like you.
Woo! I'm the David now. But anyways, today, just for all of you out there, we've got an amazing sport doctor just for you.
you.
Welcome in, Dr. Foo Lin.
Thank you so
Hello,
much
Dr.
for having
Foo.
me here. It's
Good
a real
to
honor.
see you, Dr. Foo. Dr. Foo, what is your slogan?
My slogan? Wow, that's a big one. I suppose for ortho, is life is movement, movement is life. So for me, sports is my kind of movement. So I like sports and I live sports, I breathe sports.
Right.
So
Sorry. I thought your slogan was, you can't fool me.
that was your slogan for me.
I put it in his
No,
mouth.
exactly,
Because his
but
name
it's
is
so good.
Dr. Foo.
No.
So you can be Kung Fu or you can be a fool. Up to you.
Definitely Kung Fu.
Kung Fu, awesome. All right. Dr. Tony, you have something to ask him, right?
Yes.
What's up?
Yeah, I think Dr. Fu got special skill, special interest in hip joints.
Yes, yeah.
Yeah.
So, I mean, I'm a sports surgeon, but my
Okay.
special interest is in hip surgery. I did my training, special training in hip surgery in New Zealand, where the All Blacks play. So that's a really awesome place to learn about sports because that's where the pinnacle of rugby is.
Right.
So my interest since I came back has been to spread the word about hip health and hip in sports. And I've been trying to reach out to a lot of people to...
What made you like the hips so much?
It's a very hip topic. Since we are on puns. But no, I think it's one of those joints that...
I mean, is it like the love handle thing?
Not so much. And I think for me, it's like, I mean, we're exposed to shoulders and knee problems in our training, but I think hip surgery is something that is a bit more unique. So that's where I kind of like learned and want to pick up this particular specialty.
Fantastic. I'm excited. Let's do it. All right, welcome back to Dr. Sewan Hall, a podcast channel for medical skills and tips like no other. Anyways, today, Dr. Foo Lin, you've got something to tell us about some funny story, is it?
Yeah, I've got 4 funny
What
stories
is
for
it
you
about?
today. Maybe not so funny for the patients, but I think it's trying to tell you a bit more about some of the common causes of hip pain in young adults and sports injuries.
Well, I'm a young adult.
Oh,
Me too,
Doctor
me too,
is
man.
a young adult.
so 40 is the new young adult
I'm
age.
the youngest
You
adult.
must be very,
Very young,
adult.
for sure.
Woo! We've got delusional people. Call it a mental therapist, please. But anyway, so what was the story about?
So I'll just share about this patient of mine that I saw in New Zealand. So, normally physiotherapists are usually, part of the allied health. But unfortunately, he was our patient because he had hip issues. So he's Irish. I doesn't mean that there's anything wrong with being Irish, but he had very bad hips because his hip was deformed and it was causing a lot of pain. And he was really sporty. He enjoyed playing this game called hurling, which is a combination of, I'm sure it's going to be on the video, but it's a combination of football, rugby, and all sorts. So it's a really violent sport, and I think it's very common to get this sort of injuries in sports like that. But his
What is
unfortunately
this?
was the hip.
Is it like,
This is a
wow.
very bad knee dislocation.
Look at
from
that
a
leg.
Very nasty tackle.
How
So-
did it happen? How did it looks like
it's
the whole
just
thing is twisted.
It's just a low tackle by this guy, and he was like charging him. So
Okay.
that's a really bad injury. But that's not a hip.
okay.
It's just an illustration of like the injuries you can get from this sport.
okay.
in
Alright,
particular.
sure.
And he plays this other called hurling too. So even crazier. A lot of contact with a stick too.
Oh,
so
my
it's a very
goodness.
popular sport in Scotland, whereby they have a tendency to kind of bring on the brave heart skills to kill each other.
So
essentially.
they kind of like bang each other down.
I mean, it's a contact sport, but I think there's some rules about how you should bang each other down as long as you're not like punching somebody else. But I
Wow.
think rules are, made to be broken, as they say.
Dr. Tony, you tried this sport before, not?
No, I don't
It's called
think.
That's
hurling.
very dangerous.
I don't think we have that in Singapore. I think you'll be charged with assault if you have that in Singapore. So there'll be a lot of concerned parents.
Okay, so what happened to your patient?
Yeah, so I was just going to use this bone model to illustrate what he had. So
Okay.
I mean, normally you have a hip is a ball and socket joint. This is the
This
socket.
is socket.
Yeah, this is the ball.
Okay, this
So
socket.
most of the time you
Right.
have a ball that is shaped like a light bulb. But in his case, he had extra bone here, as you can see with my illustration, the blue tag.
Extra bone.
Yeah, extra bone on the head neck junctions. It doesn't look like a light bulb, so there's
Okay.
extra bone here.
Okay, is that
And what
normal?
happened is not normal. Well, I mean, doesn't always cause problems, but in his case, it was very sporty.
Okay.
So you imagine, like, if it's a ball and socket joint, if you have a nice clearance here, a light bulb, a sexy curve here,
Yes.
you would miss the part where you hit the edge of the socket.
Okay.
Because he had extra bone here,
Where's actually the extra bone?
right on this part of the ball.
This one?
Yeah, just next to the ball.
Okay.
So it isn't like a normal light bulb, but it jams against this part. So he has what we call an impingement. So
Okay.
femoral acetabular impingement. Femur means the femur bone, the thigh bone. The acetabular means the socket bone. Impingement is just a medical term for jamming. So this nasty bone here that was really just jamming against him. Every single time he was like, bending down, flexing his hip, it was going to carve into it, and it was really damaging the socket, and he was destroying his hip. So as a physio, he really tried to exercise. He did all he could, but it was really just nasty, and it was in a lot of pain when he saw us.
okay.
And he had the problem on both sides. It's very common to have this deformity. You're born with it somewhat, but potentially genetic.
How many people are born with this?
About 20% of people actually have, mild forms, different severity of this condition. But in his
Okay.
case, it was pretty severe, as you can see in the picture here on the X-ray, which we would overlap. So this is normally what you see is a nice curve of the bone here.
Okay.
In his case, he had this little bump here.
So
that
it
you can
keeps
see on the scan.
hitting onto
Yeah, exactly.
the socket part.
It's akin to saying that you're putting a square peg into a round hole.
Right.
So this is a square, you're having a peg, so it just does not go.
right, yeah.
Essentially just like jamming his hip the whole time.
Okay.
So poor guy just couldn't play anymore, like
Okay.
despite all the things that he was doing. Yeah.
If the person just walk and not doing sports, do they have problem if they have that
Yeah, so
deformity?
in his case, if you have a mild deformity, if you're not a very sporty person or a couch potato, it shouldn't really cause a lot of problems. But in his case, he had a bad deformity and he was really into all this sort of sports. And we told him that like, you can stop playing sports. And he was like, nope, sports is a way of life. As we had mentioned earlier on this episode, sports is very important, and to him it was part of his life.
So then, what was his solution?
So the solution that for him was unfortunately surgery, because there's no way you can take away the extra bone with medication. There's no like bone resorption medication you can
Okay,
take.
okay.
So in his case, we did a keyhole surgery to remove this part of the bone and gave him a sexy hip, and there was that curvature that now he does not have any more impingement or jamming. So he's now got a really nice and sexy hip. And we like the
Wow.
light bulb shape, which what we saw here.
I see.
So after the surgery, he was able to return to his sports, and he's back to bashing people, destroying people. And
So after that, no
back
more
to his
problem
sport.
already.
No more issues.
So means that deformity can be solved.
yeah, it can be.
It doesn't have to stop your life from
You don't have
to
to.
the fullest.
Yeah,
Oh,
which is
okay.
where we come in, because unfortunately in the past, when you have this problem, it tends to be a major surgery, like with a major incision and opening up the hip, dislocating the hip. And now with keyhole and advances in hip arthroscopy, we are able to deal with this, and patients return to their sports quite quickly with very little downtime.
Can this be treated without surgery?
So if you have a mild deformity and you're willing to tone down a bit of the sports and change your lifestyle, like we always go conservative first. So in his case, like he tried, he's a physio, so he was able to physio himself to the max. And despite all that, after about 3 months of doing that, he was still in a lot of pain. He couldn't play sports, and that's when he opted to go for surgery.
So if a person with this kind of condition wants to play high-level sports, they need to have surgery.
Yeah, if it's causing him problems, unfortunately, it would be something that you have to consider.
Last time you said the surgery is open,
Yes.
and now you can do it
Keyhole.
arthroscopic.
Yes.
arthroscopic.
Keyhole surgery. Yeah.
Keyhole.
One last thing. What is arthroscopic?
It's just a medical term for keyhole. So as opposed to cutting and making a big wound to get to the hip,
Okay.
you're making two small holes, like really literally a keyhole. Yeah.
How many holes?
Interesting.
2 or 3. What kind of holes are you interested in?
Somebody get that out of here, man. Okay, we'll come back with more information and stories. See you next part. We had one story about an Irish basher, and now what is the next one that you have seen or what you know?
Yeah. So the next one is not really my patient, but it's more about sharing that this is actually a very common problem that affects a lot of sports players. And I mean, Kai Nishikori and Andy Murray, those are actually the two
Andy
top
Murray?
level tennis players that
Oh.
have actually had this particular issue.
He looks
and
like
had
Andrew Garfield from Play Spider-Man, right? Like that, right?
in that state, maybe with the mustache and the beard. But yeah, Andy Murray and Kei Nishikori, those are the
Okay.
two more recent players that I think some of the listeners can relate to.
Okay.
They actually have this problem.
So you
and they
play
actually
tennis and you
underwent
can
surgery.
break your hips.
Or you can jam your hip, man, because
Oh, how?
you can just,
How? What
just
happened?
imagine the way that they actually have to lunge at the ball, all this little movement. They really push a lot into the hip. And actually, it's very common among squash players.
Badminton?
Badminton depends on your level of play.
He is worried.
Do you,
How
do
often
you, do you lunge?
play,
Do you
sir?
lunge for the shuttlecock?
Yeah, but you should do that, right? I mean, you're supposed to do
You
that.
do.
You're supposed
Yeah,
to
you're supposed to.
do this,
Yeah.
right? I mean,
Yeah, so which is why like patients with this problem, they tend to jam their hips. So not so much, like I said, not so much of my patients, but just to bring into the viewers
spotlight.
spotlight that this actually is a very common
What
problem.
does jam hips mean?
Jam means like I'm showing you
I know
the
traffic jam, but I'm not
right.
sure what is jam.
Oh, jam is like this is a we call it jamming. Like it just gets stuck. Two collision between two parts.
And then you
yeah, you feel pain. Yeah, really. Like it will really stop you. Like if you actually have that problem and it hits you, you're like like it stops you from doing what you're doing.
Okay. And so what is the?
You need to jam hard or
Oh,
because
don't-
I play badminton a lot and I never feel
Maybe you don't have that impingement,
Not-
like extra
not good
bone.
enough.
So you have sexy hips.
Sexy
so you
hip.
don't have the extra bone that causes
I hope
problems.
so.
I promise there is no homosexuality involved here. But anyway, so you jump the hips, and then what occurs next?
So what occurs next is depending on the type of sports you're playing. So in this case, these are top players. It's their livelihood. So they can't stop playing just because they have this problem. So they actually
Okay,
have to
yeah,
undergo
yes.
the keyhole surgery for both Andy Murray and Kai Nishikori. But unfortunately for Andy, once you bash your hip too much,
Okay.
it gets too damaged.
Okay.
And in his case, like even though he had that keyhole surgery to remove the extra bone that you're talking about, he ultimately had to go for a resurfacing a hip
okay.
replacement because
Okay.
the joint unfortunately was too far gone.
Can I just ask?
Sure, yeah.
So Andy Murray, the hip, the femur was initially normal because he jammed too much and developed. that.
Oh no, he actually had the cam bone, the axial
Oh,
deformity.
okay.
So it was jamming
Again,
against the
extra
socket.
bone again.
Yeah, I mean that's usually a most common problem.
So that
amongst
one
Caucasians.
does not form because of sports.
It's a
It's
chicken,
already
or,
there
chicken or egg
before.
thing
Yeah.
because we don't really know why this extra bone or cord can appear, but genetic and also I think it is amongst the young active male. That tends to be the demographics for this cam bone. So
Okay.
whether or not like being exposed to sports early on in life actually makes this bone because you're actively hitting that growth plate where the bone is, and that causes extra bone to form. But we don't know. We don't actually have enough data to say that. But it's very common amongst middle-aged, sporty, young middle-aged, sporty men.
So they must have problem at the beginning when they start playing.
Yeah, for
already
sure.
got
They might
problem.
have some mild pain, but as we know, athletes being athletes, we ignore pain. Pain is gain. Like we just assume that it's just a muscle ache, and once it progresses. So in this case, I think if you push it and ignore it, it can actually lead to quite bad arthritis.
Honestly, I think like bone pain and muscle pain doesn't feel the same, right?
Nah, it shouldn't.
Like muscle pain feels like a pull kind of pain. Bone
Yes.
pain is like a
Chronic.
poke kind of pain, right?
Yes,
They're
usually.
different.
But the hip joint is very deep, so it's harder to really pinpoint where the pain is. If you have a knee pain, normally it's very superficial. You can actually just poke it and you can feel
Right.
it. But the hip is so deep, I can't really poke like exactly where the hip is to identify the pain. So
Right,
it's harder
I
to
see.
identify like tendon pain or bone pain and muscular pain in the hip.
Then what's the solution for?
Oh, this is where people like us train to identify the cause of the pain come in, to find out how we can help, find out the cause of the pain. So that's this story about Andy Murray and Kai Nishikori, to illustrate our point about how common this condition is.
So the surgery of this condition and the previous one we talked about is the
similar.
same.
Yeah.
Similar.
Oh, similar.
Keyhole.
Keyhole. Yes.
Keyhole, yeah. Right, I see. All right, back in here again. So we heard a lot about having a chem bone.
Yeah.
Extra bone. And that can cause, problems if you are doing sport, especially if you're doing it for your livelihood, right? Next thing that we want to talk about is about a marathoner?
Yes.
A runner.
Yes, unfortunately, yeah, it's a personal story because it's actually a friend of mine who runs marathons. So
Right.
this story is about how, unfortunately, he has, as opposed to the first two cases where like extra bone, this guy unfortunately had less bone. So I would explain what that means. So ball and socket joint. So in his case, he had too little bone on the socket side. So
Okay.
the ball was exposed a lot more than usual. Normally the ball should be covered quite adequately by the
Okay,
socket.
okay.
In his case, there was too little bone on the socket side,
Okay.
so it was very superficial.
Right.
So when you're very superficial joint, the joint can come up very easily, and it puts a lot of pressure.
Very scary.
Yeah, it's called dysplasia. It's a very technical term, but it just means shallow socket. So when there's not enough
Okay.
bone on the socket side, and
Okay.
the ball is exposed. In his case, because he was an active marathoner, he was putting a lot of pressure on his hip. Because I'm sure you remember your physics lessons from school, surface area, pressure, stress. So when you have less
No
surface
way.
area,
I've done that 10 years ago. I'm not going to go back and look at that again, right?
yeah, so when you have less surface area, it just means that it's a lot more pressure over the area. So yeah, when you have the same body weight passing through it. Thankfully, he was quite thin, so it wasn't as much of a problem compared to someone who's bigger in terms of the
Wait a
pressure on
minute.
the hip.
Talking about you.
I'm talking about you. No reference to anybody here, but but do you run?
In your mind.
Oh,
No, but
Yeah.
okay.
So back to the story,
honestly,
yeah.
I love running. Do you love running, doctor?
Yes, I love I do.
Running, especially in Singapore, 10 km. Just in fact, a few weeks ago, we just had a 2XU marathon in Singapore. That was an amazing blast. We love running marathons.
do you run
right?
it?
When,
My wife ran it.
oh, you went for 2XU
My
marathon?
wife ran it.
Your wife
actually.
was there?
Yeah, it was too short for me.
I was still asleep at that time, so I didn't run it. But I run it in my dreams. Yes, in my dreams, exactly. But honestly, running is it's simple task, right? I mean, it is nice, it is fun. When you run, especially when you go for running clubs, join a running club. I'm making one soon. Stay tuned. So join running clubs. And the thing is that how does that, can even cause hip injury? I've never actually really heard of hip injuries through running.
Yeah. Oh, shallow sock. I mean, hip injuries can occur in anybody, but I think for running, especially because of all the pounding and all the movement that you do, especially long distance running. So in his case, unfortunately, he had that shallow socket, and it was really putting a lot of pressure on his hip. So ultimately, he had like pretty nasty arthritis that developed in his hip, and even though he was in his 30s, in his 40s, I had to kind of tell him that like, maybe you shouldn't run. But to tell somebody who enjoys running not to run is really almost telling
Yeah,
them to
stop breathing.
Stop breathing. Yeah. So being a doctor, that was really tough. A personal story. I think breaking bad news it's not as bad as breaking bad news about cancer, but as a sports doctor, telling someone you can't play sports is pretty bad. I mean, personally. So that was something that I had to tell him. Yeah. So that was a shallow socket issue.
So what is the alternative?
So the alternative for him, if it's something that bothers him a lot, like it can consider surgery too, but unfortunately there's no keyhole alternative for this kind of surgery.
Okay.
You're really trying to make more bone on the socket side to deepen it. So that part usually requires, we can try conservative stopping running, physiotherapy, but
okay.
unfortunately you can't really make more bone on that side to cover more of the head. It does require a surgery. In his case, he was not suitable because his hip was too far gone. But in younger patients like 20s and you have a very shallow socket and you know that you're going to have problems with the hip in the future, we can definitely have that discussion about having surgery to deepen the socket. Yeah, but that's not keyhole. It's something called PAO, again, technical term, but it's something to deepen the socket, to cover more of the head, to reduce the pressure around the hip joint.
So are you saying that having too little bone is worse than having too much bone?
Equally bad problem, but I suppose for the cam, there's keyhole option, but for the shallow socket, normally there isn't really a keyhole option.
So then you should know about your condition since you are very young.
Yeah, there is a screening program actually for hip
extra bone
dysplasia,
and all
for
that.
shallow bone in
Shallow
Singapore.
bone.
So when babies are born, we do this.
Tell them. I actually never heard about it.
Oh, right, okay.
And soon I may get married, so tell them.
Yeah,
Tell me.
So tell you how to do it. So it's a test called the Barlow's and Ortolani's test. It's a test that we use to screen for shallow sockets in babies, whether the hips dislocate. So, normally it will be done when they are born by the pediatrician. They will check the hips to see if it's clicky. When it clicks, it means that the hip might be coming in and out of the socket. So when you have that clicking sound, normally we are a bit concerned that this patient, this baby could have a shallow socket, and we actually have to treat it and monitor them closely. So if you have a baby next time, remember to check for clicky hips.
Right. Help Singapore's aging population and do get your babies checked so that their future will be a sporty and a bright one. So yes, we talk about baby screening for your baby hips, but when they are kids, right? Let's say how old? 10, 12, right?
No, even younger.
Even younger, 8, 9, 7, 6, 5, 4, 3, 2, 1, Happy New Year. When they are still very young, right? What symptoms can parents look out for to know that, bro, your hip has some problem, man. I must fix it.
Yeah. So as good as the screening program is, there are cases that can get missed, and some of them do develop some of these problems later on. So the first thing to look out for is usually pain. So this child or like children of that age normally complain of pain. They're unable to participate in some of the physical activities like running around a playground and might struggle with that. And when they walk, they might limp. So all those things point towards a possible hip problem.
Okay.
So when you have these issues, you should definitely consult a bone doctor like myself or Tony to find out what's the cause of these painful hips. And it's really important to pick it up early because I was saying earlier on that in my friend's case, the marathoner, the hip unfortunately was too far gone. So if you pick it up early, there are actually a lot of possible ways to help to prevent this problem or reduce this problem.
Right, I see. But actually, to be honest, right, like, does it have anything to do, for example, like with the mom when she's pregnant not eating enough, or is it just like by DNA you are fixed to have that sort of hip problem?
Oh, that's there are risk factors that are associated with DDH or developmental hip dysplasia or shallow socket, as we call it for layperson. But yeah, I mean, we don't have a conclusive evidence that any of these things are the thing, but there are definitely associations. For example, I think patients big babies that can cause problems because it's a packaging disorder, meaning that when the sounds a bit horrible, right? Packaging a baby in the tummy. Packaging disorder. And a big baby in a very confined tummy space, they are very tight, so the hips might be kind of pushed into awkward, weird positions.
I see.
So it kind of affects the development of the hip, and that potentially could lead to some of these DDH or hip shallow sockets.
Actually, doctor, what is the average weight of a baby? When a baby just born, what is the average weight?
I don't know the statistic, but I think around 2.5, 3, 3.5 is
about there. My daughter, when she was born, initially they predicted a 3.4 kilograms baby, which is a big baby.
And then?
But it came out she was 2.6, so she was.
When I came out, I was 4 kg.
Whoa.
Yeah. I came out a week late.
How are your hips?
Sorry,
how are your hips, bro?
2 weeks late. Yeah. I don't know, but my hips seem very, very fine. So
I'm sure you have fine hips, bro.
Yeah, man. Yes. Amen. The other thing that we were actually thinking about, right, was the word yoga. Many people in Singapore love to go for yoga, if we see, and they love to go for this flexible thing, try to stretch. I'm actually one of the most unflexible individual probably out there. How about you, Dr. Tony? Are you very flexible?
I'm not very flexible, but not unflexible also. Maybe average.
Right, I see. How about you, doctor? Are you, can you do some weird stretches?
I'm a runner. I'm not flexible. Runners are not flexible. My daughter is, though. She's a gymnast and she's very flexible.
Actually, is that actually healthy for the bones?
I have this debate in my mind sometimes.
Cruel.
I don't know. She enjoys it. No, she's actually flaunting it. Like we have this case of Liberty Barros, the
Barrows,
most flexible person. Look at that shape.
Till today,
I think she is. I mean, it's hard to separate one from the other, but she is definitely well known for that.
So
freaky,
excruciating pain.
Yeah, it looks like a movie, like a zombie movie, like the guy.
Those exorcism movies where they get demon possessed kind of stuff.
I know. Yeah. So my daughter can't do that, but she can bend backwards. Yeah.
Okay.
So the story for our fourth case is actually a patient, who's actually a yoga teacher. She doesn't practice, so she actually teaches yoga.
Okay.
So we always thought that the hip is a very stable joint because it's a ball and socket.
Yes.
In her case, she had hip pain because her hip was actually loose. So we don't talk about just the bone, but actually there's a balloon that surrounds the hip. So if you look at this part here, this brown part is actually the part that surrounds the ball and socket, which is inside. So in very flexible patients, this balloon is very loose. So the ball can actually come out sometimes and come back in again. So it doesn't just come out outrightly, but it actually goes almost sort of out in order to be able to do those things that she does, because otherwise it's impossible if the bone is inside.
Okay,
So in her case, and some of these very flexible people, the ball actually comes out of the socket because of how flexible they are. And it's natural for them. There's a range. If it comes out for us, we are screwed because we can't get it back inside.
Totally,
for these guys, like it's habitual, like they can actually dislocate and put their hip back again, and it's normal for them.
Oh my God.
Yeah. But in her case, unfortunately, she had hip pain and she couldn't practice yoga because I was causing problems in her case. And when I saw her, she was really desperate because the people that saw her were saying that you need a hip replacement, stop doing yoga. And same thing with running. If you tell someone, like a yoga teacher, to stop doing yoga, what do you want them to do?
Correct.
And it's their livelihood, it's something they enjoy doing, and it was something that was really heartbreaking for her too. And thankfully she was referred to me. I actually came back from my fellowship training at the time, and she was referred to see me, and we went through her case, and I found that she had a really loose hip joint.
Okay.
And what we did was really to tighten up the balloon.
Oh, okay.
So very technical, but it's a balloon. We cut it, we reduce the size of the balloon, and we overlap it just to reduce the size of the balloon. So she would have less movement of the hip, and that allows the hip to settle down and to reduce any further injuries to the hip joint. So again, arthroscopically, keyhole, so she was back to doing yoga in about 4 to 6 months, and she was just very thankful that she was able to go back to that.
Okay, for this kind of cases, right? They are very flexible, and they can pop out the hip whenever they want.
Yeah, my goodness, but
if they don't do that, can they live a normal life? If they don't stretch it, they don't do funny things.
I mean, they don't do yoga?
I mean, you can do yoga, but you don't do it to the extreme that it can pop up.
Yeah, I think sometimes it's quite self-selective because some people could be flexible and they actually enjoy doing yoga because I'm so flexible and I do yoga. So I think some of these people are self-selecting. And I mean, in her case, she definitely was told to stop yoga and stop doing that in order to reduce her pain, but it was something that she couldn't give up, and it was a livelihood for her. It was a way of life. She went to India and spent about 10 years learning yoga, and she was teaching it here, and it's just something that they grew up with, and it's impossible to take that away from them sometimes.
But which part of yoga that is not good for this kind of cases?
There are a lot of poses, obviously, in yoga. I don't know the major ones, but there are a few. Like the one we saw just now, you can actually...
Not the extreme one.
Not the extreme one, yeah. But yoga in general is good. I mean, there are different poses for different parts of the body that would...
So normal classes usually are not extreme, right?
No, I mean, normally not. But I think when you are doing yoga, you want to improve. You want to do fancy things. It's in life, right? You're not happy if you're just one thing. You run faster, do more, you be more flexible. So that's the usual problem when that happens.
So after the surgery, you tighten up the capsule.
Yes.
The
balloon.
The balloon.
Yeah.
Tighten up the balloon, and she can go back to yoga again.
She was able to, but very progressive. She has to go back to it because it will be tight if she first starts because we tighten up the balloon, so she's less movement. So she might be frustrated. And something if you always tell patients when they go for this surgery because they're so used to moving, right, the hips all over the place, and you tell them after the surgery you might have some reduced movement. So you must manage expectations. You must be able to tell them what to expect. They'll be very devastated if they say, "What happened, doctor? I thought I can go back to yoga, but So yeah."
So she is happier before or after the operation?
She's happy that she can't do the crazy extreme stuff that she was able to do before, but she was not in pain and she was able to do the basic stuff.
Okay.
She didn't come back after that 1 year follow-up, but she was essentially back to teaching yoga. And thankfully, she's not she doesn't have to demonstrate too much of the crazy poses, and she has learned to moderate her activity level.
I see. Fantastic. A lot about the hips, and we heard a lot about things that we should be careful of and injuries that you may get from doing our favorite sports. But today we have Dr. Foo Jianlin. And Dr. Foo, before we go, tell all our viewers out there, right, just some tips. How can we take good care of our hip so that we will stay on track?
So don't ignore the hip pain, and do look out for people like Tony or myself if you have hip problems so that we can help you. And don't give up on your sport because, sport is life and life is sports.
Wait a minute. Look for me as well, right?
Oh, yeah. Of course.
Look for me as well, yeah.
Running tips.
I will help you with your hip. I'll ensure that you will run, and you're going to run like never before.
And because it's a hip talk, we must all say, hip, hip, hooray!
I thought I was the only young adult. I realized there are younger ones. But anyways, let's do it again. Ready? Are you ready?
Yeah, of
1,
course.
2, 3.
Hip, hip.
Hooray! As always, it must be special. So remember to
Like us.
share.
And subscribe.
That's right. Love our videos. Mad Talk Singapore. We're about to grow and about to go from glory to glory. And on that note, we'll see you again in the next
Dr. Say One
Ho.